Health Minister Dr Motsoaledi, meanwhile, says the international health insurance will go ahead as planned. Some of the hospitals that will start the pilot project include Limpopo Central Hospital, Bophelong Psychiatric Hospital in the Northwest, and Bambisana Hospital in the Eastern Cape. Joining us now is Professor Benjamin Smart from the Center for Public Health at the University of Johannesburg. A very good afternoon to you, Prof. Thank you very much for your time. Ain't no stopping it now, says the Health Minister. The NHI is very much on the move.
Yes, apparently so. And I wish them all the best of luck getting it going. I just don't see how it's going to reach the full implementation stage and certainly not achieve its goals.
Well, from what he told Parliament the other day, the approach is going to be incremental. You're not going to do everything all at once. It's going to be a step-by-step process. Does that take care of the fears that many people have?
No. And what he actually says was no country in the world that's implemented NHI has done it straight away. But so far as I'm aware, and I can be corrected if I'm wrong, no country in the world that I know of has implemented anything resembling NHI. So what NHI is essentially a medical aid run by the government that gives everyone in the country access to private medical facilities. The big problem with this, or one of the big problems with this, is that even at full capacity, the private healthcare sector can only accommodate 20% of the population, meaning that 4 out of 5 South Africans are not going to be accessing private healthcare regardless. So this doesn't give everyone access to private healthcare, which is, sort of what people are being told at all. At best, it gives 20% access to private healthcare and perhaps addresses some of the egalitarian issues. Maybe more people from lower income households will have access. But again, the vast majority of people are going to be using government hospitals. And so it seems to make much more sense to focus any extra money that's coming in on improving healthcare that everyone can access.
But how much of it, Prof, has to do with the fact that there is a lot of opposition to it, and that opposition comes in the main from very powerful forces and actors within society?
Well, I mean, it's not surprising that you get a lot of opposition from the middle class, and all the powerful people are middle class people. You see, when NHI is fully implemented, any treatment that's covered by NHI will not be able to be covered by private medical aids like Discovery and Momentum and so on. And what this effectively means is that the people that are currently paying for their medical aids will no longer have guaranteed access to high quality healthcare, because there's an enormous gulf between private medical healthcare and that provided by government. And so, of course, anyone who currently is able to spend their money, choose to spend their money on good quality healthcare, but will no longer be able to when NHI is fully implemented, will be really opposed to that. And frankly, I suspect probably willing to up and leave the country. I mean, if you can't guarantee your family good quality healthcare and you've got plenty of money and you can leave, I think people will leave, and that will further erode the already tiny tax base. And just in general, this doesn't seem like a great plan,
But then the egalitarian issues, as you call them, remain, and that's a fact, isn't it?
Absolutely. And look, every South African has a constitutional right to quality healthcare, and that right is not being met, and something needs to be done. But NHI is not that. You see, as I said just now, even when fully implemented, the private healthcare sector can only accommodate 20% of the population. So 80%, even if everyone receiving the private healthcare is now the poor and all the middle class are going to government hospitals, that still leaves 4 out of 5 South Africans in government healthcare. So what needs to happen is that government healthcare systems need to be improved, and that can only be done through investment. It needs a lot more funding and eradication of mismanagement and of irregular expenditure and corruption, and just generally run the government healthcare system more efficiently and more effectively.
I mean, to those, are you saying that the question of more funding and the like should be preconditions? Can we not start small? Is what I'm trying to ask here.
Well, what would starting small look like? I think the primary issues are funding issues. There's not enough money to go around. And so the ways to improve that, or at least the money that we have, is a lot of it is being misspent. So, we have all these examples of corruption, money being spent on skinny jeans. And if you look at the Auditor General's reports, huge amounts of money go missing. We need to eradicate corruption, and we need to get people in that know, that can work out how to best spend the money, right? So that might involve computer scientists coming in and solving optimization problems to work out how best to spend the funds. But ultimately, we need to learn how to spend the funds we have more efficiently, and probably raise some more funds as well, even if that's through taxation.
What I'm trying to ask, Prof, is whether there has to be, in other words, we should insist on preconditions. In other words, it has to be this way or the highway. In other words, can we not say we will use the money that we've got and we will fight corruption or prevent corruption? At the same time, we will have these computer scientists and other people who will look after the integrity of it all. Can these things not all happen at the same time?
It's certainly true that one could implement NHI and improve the government healthcare system at the same time. But the reality is, as I said twice now, NHI will only help 1 in 5 people. So given the amount of extra investment that NHI is going to require over time, why not use that extra investment to improve the facilities that everybody can use?
What can be done now to get everyone to come together? There's been that there can be a tornadoing of sorts, but where everyone would have to accept that compromises and sacrifices would still have to be made. In other words, we can't insist on perfect conditions before we move. Well,
I think there was a bit of confusion, but Minister Ramagopha was engaging in some kind of talks where they would allow the medical aid companies to continue to provide medical aid, which would be against the current version of the bill. So the current version of the bill says if it's covered by NHI, then Discovery, for example, can't cover it, right? So I think to mitigate the effect on the middle class and stop everyone from running away and stop doctors running away, you could end that clause. But it certainly seems that Dr. Motsoaledi wasn't interested in that at all. And there's a lot of conflicting news stories coming out at the moment. I think that would, to some extent, appease the people who will be paying for this, which is essentially the taxpayers. But even then, we're still going to have this issue that it needs to be funded, right? So I guess the original idea was that the money that people are currently paying to their medical aids will now be paid to NHI instead. But if people are paying to NHI and they need to pay to Discovery as well, that most people aren't going to be able to afford that. To my mind, this whole thing has come around as a way of trying to persuade the South African people that they're going to have access to good quality healthcare, which they should, and they have a constitutional right to. But giving them access, but saying, oh, well, we'll improve the government healthcare system, doesn't really work because it's in such a state. So they say, oh, we'll give you access to private healthcare. But that's just not going to work. The private healthcare system just isn't big enough for that. It doesn't serve enough people. So really, the only way to give everyone access to high-quality healthcare. The only way is to focus all the attention on the government healthcare system and improve that. And there are many things that can be done to do that, starting with eliminating corruption and holding those that are responsible accountable, but also just improving the general efficiency of it, looking at the healthcare economics of it, optimizing the strategies, making everything more efficient, and just improving infrastructure and all the things that you need to do in order to improve a healthcare system. This doesn't happen overnight, but if you do that with the government healthcare system, then that improves the quality of healthcare for all.
Professor Smart, let me thank you very much for your time. Really appreciate it.